what Bryan Johnson says AI is revealing about capitalism, and why it matters to all of us. For most of modern history, capitalism ran on a simple idea. Everyone looks out for themselves. Markets balance things out. And somehow, it works. That idea even had a poetic name, the invisible hand. But according to Bryan Johnson, something fundamental has changed. The hand isn't invisible anymore. The big shift, in plain language. Capitalism worked when no one could see the whole picture. In the past, businesses didn't really know the long-term consequences of what they were selling. If a product made money, it was considered successful. If harm showed up later, somewhere else or in someone else's body, that damage stayed mostly invisible. So the system kept going. AI changed that. Today, algorithms, data, and AI can see patterns no human ever could. We can now clearly measure how food affects disease, how apps affect mental health, how stress affects biology, how attention is hijacked, how addiction is engineered. The system is no longer blind, and once you can see harm clearly, pretending you didn't know stops being an option. The uncomfortable truth Bryan is pointing at. Instead of using this new visibility to help humans thrive, many systems used it to extract more. They learned how to hijack attention, create addiction, sell ultra-processed food, push short-term pleasure. Not because it was good for people, but because it was profitable. And now the consequences are everywhere. We see them in chronic disease, anxiety and burnout, obesity and inflammation, social fragmentation, rising healthcare costs. The old excuse, we didn't know, doesn't hold anymore. So what changes? According to Bryan, the goal of business itself has to evolve, not overnight, not perfectly, but directionally. Instead of asking only, does this make money? We also have to ask, does this improve human health? Does it support long-term well-being? Does it help or harm the human species? That's the shift. A new kind of currency. Bryan's most radical idea is also his simplest. He suggests that biological health should become a core measure of success. Very plainly, if something improves human biology, it's good. If something degrades human biology, it's not. Health stops being external. It becomes feedback, not vibes, not ideology, measurable outcomes. What this looks like in everyday life. This isn't abstract philosophy. It's about changing the scoreboard. Food companies. Old system, cheap ingredients, highly addictive, extremely profitable. New question, does this food increase disease, or does it improve metabolic health? Under this lens, selling food that predictably harms people isn't just business, it's a design failure. Social media and tech, old system, maximize screen time, dopamine loops, polarization equals profit. New question, does this product increase anxiety and addiction, or does it support focus, stability, and well-being? If a product burns out nervous systems, calling it innovation starts to feel hollow. Work culture, old system, grind, normalize burnout, externalize health costs. New question, are people sleeping? Are they mentally stable? Is illness a predictable outcome of this model? Health becomes information, not collateral damage. Is this realistic? The honest answer? Partially. Some parts are already happening. We're seeing insurers reward preventive health, employers track burnout, governments regulate harmful ingredients, consumers punish brands faster than ever. The direction is real. What's not realistic yet? Capitalism changing overnight, universal agreement on perfect health, removing profit motives entirely. Capitalism doesn't move because of morality. It moves because incentives change. That's the real bottleneck. What it would actually take. This is where the idea becomes practical, not idealistic. 1. Better feedback loops. You can't change systems without clear cause and effect. That means tracking long-term health impacts, connecting products to outcomes, removing plausible deniability. This is where AI genuinely helps. 2. Aligned incentives. Businesses won't choose health just because it's nice. They will if unhealthy models cost more, healthy models are rewarded. Regulation, insurance, or reputation enforce it. Capitalism doesn't disappear, it reorients. 3. Minimum standards, not perfect health, just baseline human viability. Things like food that doesn't systematically cause disease, tech that doesn't destabilize children, work that doesn't require chronic stress to survive. This is closer to public safety than ideology. 4. Cultural maturity. This is the slowest part. It requires longer time horizons, less addiction to short-term pleasure, less tolerance for everyone does it excuses. No algorithm can do that work for us. Where AI fits, very simply, AI isn't the moral authority, it's the mirror and accelerator. It reveals harm faster, scales incentives faster, removes excuses faster. Whether that leads to human flourishing or more efficient exploitation depends entirely on the goals we set. The real takeaway. What Bryan Johnson is really saying is this: we've reached a point where our systems are powerful enough to see exactly how they affect human health and behavior. Once that visibility exists, continuing to profit from harm is no longer neutral. Capitalism must evolve to reward human well-being and long-term survival, or it will collapse under the weight of its own consequences. No villains, no halos, just systems responding to new visibility. And that visibility, whether we like it or not, is here to stay.